Alright, hello. This is Annie Wilkin, and I am presenting Refugee Health Concerns. Refugees are groups of people who seek refuge in other parts of the world for many reasons. Usually, this is because their country is war-torn and there's associated government upheaval and just is unsafe. There are language and cultural barriers for these refugees who are relocated to other parts of the world, and often health concerns pop up because they're in a new environment and health concerns might kind of take a back burner for them for a while. So there are 60,000 refugees approximately that live in Utah, and the majority of this number live in Salt Lake City. In 2017, there were 53,691 refugees admitted to the U.S. This number has decreased a little bit the last couple of years due to some government regulations. And globally, in 2018, there were 30 million refugees relocated to other countries. So some social determinants of health for refugees are education, depending on where they came from, and the customs there, the values, the gender roles. They may not be well educated. There's often a language and a literacy barrier. Not always. It depends where they came from. Some refugees, depending on where they're from, they learn English young in school. Some other factors, they may be prone to discrimination because they look different, they dress different, they're different race. Social cohesion and civic participation kind of go hand in hand. They might feel different and like they're being stared at, and they kind of feel uncomfortable and scared in their new country, and so they kind of stick to their own group. Health literacy, they might not be very health literate, or they might have a different view of health based on the customs or their religion from where they're from. We've already talked a little bit about these, but yeah, they look different, they dress different, often cultural differences, and some different social interaction cues and social customs might not fit in so well here in the U.S. So the root causes of these health concerns for refugees, really it's just that they're in a new environment that they're uncomfortable or unfamiliar with, and they're afraid. So on Maslow's hierarchy of needs, some of these needs will be met and unmet. So physiological needs, safety needs, and love and belonging needs, those could all be either met pretty easily or unmet for refugees. Generally, their physiological needs should be met. The United Nations provides financially for their food, clothing, shelter, relocation, the first few months till they get settled in their new country. Safety, once they are kind of into the refugee program, they should be fairly safe. They might not feel safe. And love and belonging, depending on if they were able to come over with their whole family or if they were separated, that might be a need that is met or unmet. It just depends. Esteem and self-actualization are probably needs that won't be met for a long time by these people because they are dealing with the lower 3-tier needs in their relocation and the stress of that relocation and living in a new country. So because of these needs, both met and unmet, they will probably have a low functional level for a while, maybe even years or possibly the rest of their lifetime, depending on how adaptable they are. likely health outcomes for this group are mental health issues, like things like PTSD, stress, depression, or chronic conditions. Chronic health issues are oftentimes kind of put on the back burner because they're dealing with the more immediate stresses of being relocated. Communicable diseases for refugees, well, they go through a vigorous health screening before they are relocated. This is required by the United Nations, who relocates them. So they're likely healthy. They're given vaccines based on the requirements of the country they are relocated to. During the transportation phase, they might be more prone to sickness depending on kind of the environment and circumstances they're in and how long it takes for them to be transported. But despite the widespread assumption to the contrary, there is only a very low risk of refugees and migrants transmitting communicable disease to their host population. So some non-communicable diseases that refugees might have are PTSD. Diabetes was a common one, and I'm thinking that's probably because it's such a chronic high-maintenance disease that it kind of goes on the back burner during the stress of this transition phase. They may not take as good of care of themselves. Cancer is often diagnosed late because they're just not willing to go in and get the care they need till it's really advanced, until they really feel like it's definitely necessary at this point. I put it off long enough. During their transition and their transportation phase, self-care might kind of take a back seat due to the stress and of relocating. Children, if they are orphaned or being transported by family members or non-family members, either one, they are very prone to sexual exploitation as refugees in the transition phase. And here are my references.